Hello, good evening, everyone. Can you hear me? If you can hear me, can you please? Hello, can you hear me? If you can hear me, can you please let me know in the comment section that you can hear me? All right, thank you very much, Osayande, Jennifer, Princess Best, and everyone. So, because of I started this class quite late, we're just going to have maybe 30 or 40 minute session today. Apologies for starting very late. And for those of you who I was in their class this week, I was not very sound or too strong last week. So I could not complete my session with you. So I'm just going to brush up a few things today so that we can catch up the rest tomorrow in class, tomorrow morning. All right. So today we are going to do a case study. So let's start. The case study, Mrs. Choma AZ, 22 years. So situation, she was eating granite, suddenly can't breathe. All right, the symptoms are lip swelling, rash all over body, wheezing, feels dizzy. Vital signs are blood pressure 80/50, pulse 120, and um, the rest of the stats that is there. Now, for those of you who are listening, the blood pressure that is 85/50, I want to ask if that is too high or too low for this particular patient. Let me know if you think it's too high. Let me know if you think it's too low. Let me know, please. I'm ready for comments. A blood pressure for an adult that is 85/50, systolic 85, diastolic 50, is that too low or too high? All right, too low. Thank you very much, Promzi. All right, because of time, I will just keep running. Too low, correct. So now, what is the diagnosis? Now, class, one way to know an allergic reaction is um, a high inflammatory reaction, especially when it occurs around soft tissues. So we can see one of the symptoms here, lip swelling. That is clearly one. All right. Then rash all over body. That's clearly one. Wheezing, which is also around the upper respiratory tract. That is also clearly one. All right. So what is the first medicine to give during an anti-allergy? With the second question. The third question, what other treatments are needed? How long should she stay in the hospital? So firstly, I'll just begin to say the first question is anaphylaxis reaction. You can have an anaphylactic reaction from taking medications and from taking food that you are allergic to. All right. So most possibly this patient is allergic to peanuts, generally granules, and other foods that are classified as nuts. All right. So it can affect the skin, affect breathing, affect heart rate and blood pressure. And usually in this case, class, the first medicine to be administered, which is number two question, is adrenaline. Adrenaline is one of the most potent drug that is used for anaphylactic reactions. Okay, anaphylactic reactions can be given in many other, it can occur in many other instances anyway. And usually adrenaline, which is also epinephrine, 0.5 milligram IM, is usually given in cases of anaphylactic reaction. I really hope that you're paying attention because most times some of these questions can come to test your knowledge in the OBG or in the theory. All right. So an anaphylactic reaction, um, you use adrenaline. Now, patients can also have an anaphylactic reaction when you give them any medication that they are reactive allergic to. For example, they can have it when you are giving medication, when you are giving some of the antibiotics like amoxicillin, the penicillins can cause anaphylactic reactions. So usually that is the reason why they discourage giving injections in non-hospital settings. So you want to go and administer a injection to a patient in the house. What if the patient have any sudden reaction that needs hospital care? All right. Now, sometimes after anaphylactic reaction, you have to also give some supportive care to this patient. Okay. However, it is advised that whenever you have to give any IM or IV medication, you actually have adrenaline in the first aid box. This patient, you're supposed to go with your first aid box as a nurse to the patient's house in case they have any of this reaction. Um, you can quickly give um, adrenaline or epinephrine. You understand? So that is the idea behind that. Now, what other treatment that are needed? You raise the legs, because raise leg to supply blood to the upper region, which is where the heart is and the brain. All right. If the patient is still having difficulty breathing, you can sit slightly up. Then, like I mentioned, if it's in a hospital setting, you can use oxygen mask. You can give IV fluid. You understand? Then you can also administer antihistamines. So in the class we are almost fainted on Monday. Thank God for destiny. Destiny is destiny in this call. Please let me know who led me out calmly. I was able to talk briefly about histamine, and I told us that there is histamine 1 receptor and histamine 2 receptors. Okay, so antihistamines generally will help reduce allergic reaction. So in addition to adrenaline or epinephrine, you can add antihistamines. You can also add steroids. When I get to steroids tomorrow, by God's grace, and this week I should be able to complete all the anti-allergy and even enter a new topic if time permits. And steroids are also very necessary to help reduce allergic reactions. You understand? So how long will the patient stay in the hospital? So a minimum of 6 to 8 hours to watch in case the symptoms come back, because after you have finished administering the care, to increase airway flow, to reduce allergic reaction, the symptom can come back. All right. So you just have to ensure the patient stay for at least 24 hours, and then before the patient can go. All right. So um, how to prevent? I think is there a fourth question? Let me see. How long should you stay in the hospital? Okay, what should she do to prevent this from happening again? All right, tell the patient to avoid any triggers. Once a patient has seen any triggers anything that can trigger what adrenaline, that can trigger allergic reaction, they should avoid it. All right, peanut allergy and any other thing. Then also the patient can carry about their what do you call it, epinephrine pen. All this adrenaline, there is a pen that they formulate these drugs in and put it in the bags. It is mobile. You can easily carry it. It's more like a pen that used to write. All right. So all the pens adrenaline are added to this pen, that whenever this patient have allergic reaction, maybe unable to decipher whether this is a peanut or this is a granite or whatever nuts, they take it somewhere they don't know. You can easily administer it to them immediately, because usually when you find patients who have this peanut allergy, the the problems are usually drastic. The actions and reactions are usually very, very drastic. All right. So somebody is asking Samuel Ojo, sir, steroids, are they not under control drugs? Yes, they are. All steroids are under control drugs, you understand. However, it doesn't mean that when you want to use it for patients who are having allergic reaction, you will not have access to them. You will definitely have access to them. Okay. So that is that for that. So let us quickly go to case study number two. Case study number two. I think what we are going to be, okay. Hay fever, allergic rhinitis. So Mr. Emeka Okonkwo, 28 years, a job is a driver, complete sneezing, runny nose, itchy eyes for 2 weeks, worse in the mornings when outdoors. So what is the diagnosis? Why should you not give chlorpheniramine? All right. Then what else can help his symptoms? What advice about his work? All right. So the symptom this person is feeling, sneezing, running nose, itchy eyes, are symptoms of hay fever. All right. And which is also known as allergic rhinitis, which what part of the symptoms of allergic rhinitis is what we usually call catarrh. Somebody is sneezing and is having catarrh. That is especially what we have here. When people are sneezing, eyes are red, that is hay fever. Okay. And then one of the triggers for hay fever is pollen grains. And usually happens at especially beginning of planting seasons, and then end of rainy seasons. Those are the two extreme periods where you find these illnesses all around. That's why you see sometimes when they start harvesting corn, maize come with a certain level of sneezing and infection, like with catarrh and the rest. Okay, this is exactly a clinical example of hay fever. persons who are allergic to these things, to pollens, they will eventually get hay fever during the harvesting of corn, because the harvesting of corn usually takes place or coincides with the beginning of rainy season. All right, we usually start seeing corn or maize around April, May. Sorry, March, April, May, and that is usually when the rainy season starts. Because sometimes some persons will start planting around January, dry season in the riverine areas, and during the harvesting of those periods leads to the proliferation of pollens. And then I'm just trying to explain to you why sometimes in a particular period of the month you start treating issues such as hay fever. All right. So why not Piriton? I think I explained to cyst cohorts. Was it cyst cohorts? Yes, I explained to cyst cohort before I eventually left the class with the help of Destiny. That there's a first generation antihistamine and there is second generation antihistamine. First generation antihistamine will cause drowsiness. Meanwhile, why second generation antihistamine will not cause drowsiness? Both of them inhibit the histamine H1 receptor, which reduce allergic reaction. All right. However, first generation will cause drowsiness, and this patient we've already read from the question that this patient, the occupation is what? Is a driver. Is a driver. So if you are giving clofeniramine, which definitely will cause drowsiness, it means that this patient cannot go to work, and you cannot tell a patient that it is cough and catarrh that will not allow him go to work. The organ will not listen to him. You understand? So we definitely look for other options. All right. Clofeniramine also have slow response time. That is, it doesn't start working on time. All right, it doesn't start working on time. So what you have to look for, you have to look for antihistamine that do not cause sedation. All right, example at the second generation we have loratadine, we have fexofenadine. I think I listed about two or three for us in the class. We have cetirizine. You understand? So that is how these drugs are given. Okay, then you can also give topical agents. I think one of the questions that are there is what else can help his symptoms. You can give topical agents. You know, the nasal roots is actually a patient who how do I put it, illnesses that affect the eyes, the nose, the skin can actually be addressed also with topical agents. You understand? So topical agents will work very well if this patient is having a job that will prevent it from taking what drowsy medication. So you just give a topical agent like the fluticasone, nose nasal spray, and then any of the eye drops that will stop the irritation of the eyes. All right. So that's that for that. Um, any questions so far? Any questions so far? We'll just have two more case studies before we call it a night, because I have another meeting by 8 p.m. So, okay, there's no question. Let's move on to the next case study. So, drug allergy rash. Drug allergy rash. In this case, we are going to be looking at the information of Mrs. Amina Hassan, 35 years old. So, she's taking amoxicillin for 3 days. She has been taking amoxicillin for 3 days for sore throat. So, one of the problems is that developed itchy rash all over body yesterday, so which is on the second day. No breathing problem, no swelling. Stop the medicine immediately. That's she stopped it immediately. So question one, what type of reaction is this? Okay. What treatment should she get? What type of reaction is this? What treatment should she get? Can she finish the amoxicillin? What medicine should she avoid in the future? And what should she do to stay safe? So we'll start from what type of reaction is this? So who can give me an answer in the comment section? What type of reaction do we think this is? Is this a food allergy? Is this a water allergy? Is this a drug allergy? Whatever it is, let me know. What's this? I'm waiting for us in the comment section. Okay. Okay, I'm seeing a question here that say, can expectorant be used for hay fever? Yes, expectorants will ultimately cause drowsiness. So in this particular case where this person is a driver, you should not use expectorant. You understand? So you can use expectorant in other cases where the patient will not need it. All right, thank you very much. Isaac and Osayande Jennifer is a drug allergy. Definitely is a drug allergy because of the medication that is there. So in this particular class, it is a drug allergy that is known as urticaria, all right, which is also known as hives. Now, in this case, the one of the major symptoms that make you determine it is hives is where the rash is itchy and is raised. What do you mean by raised? That is, it is higher than the skin level, a little bit higher. You will see it. All right. Then hives also, they do not cause breathing issues. So because they are just localized on the skin, so there's no breathing issues. Okay, so it's a mild drug allergy. Okay, so there is no breathing problem, there is no dizziness, there is no fainting, there is no tongue swelling, there is no lip swelling. All right. So remember in your second semester 100 level, I told everybody in this class that one of the first steps when there is a drug allergy is to withdraw the drug. It does not matter whether this patient is taking an HIV drug or this patient is taking anti-cancer drug. If there is a drug allergy, you withdraw it because that drug allergy will eventually kill the patient before the illness the patient is taking the drug for kill the patient. So what you just have to do is what? Withdraw the drug. And then because this is an allergic reaction, okay, and it is not threatening, remember the first case study we did, the patient was what? Threatening. Okay, that's why we have to give epinephrine or adrenaline IM 0.5 milligram. Okay, now this one is not threatening, so we can give oral medication. Okay, we can give antihistamine, we can give cetirizine, we can give chlorpheniramine. All right, we can also give steroids. Steroids, all these are class of drugs that what can help reduce um, allergic reaction of any class. Okay, now the third question says, can she finish amoxicillin despite taking this medication? Let me see. Who can answer me? Can she finish the amoxicillin? Can this patient finish the amoxicillin that she was given? I'm waiting for the first few answers. Okay, thank you very much. No, she cannot finish the amoxicillin. Okay, she cannot finish amoxicillin because why? Despite she's taking what they call antihistamine that will reduce allergic reaction, it doesn't make her immune to further complications that will come up from continuing that drugs. All right, so she must stop it and not use it again because next time it could be worse, it could be severe. All right, so if she needs any other medication, she should go to the hospital and the doctor will prescribe a non-penicillin antibiotics for her. All right. So all the medicines that she should avoid forever are all penicillins. And sometimes when I teach you antibiotics, she should also avoid cephalosporins. Cephalosporins and penicillins, they have similar body or similar chemical structure. So whatever this penicillin is reacting to, cephalosporin is also reacting to it. All right, that's why you see sometimes when you see a laboratory test and you're seeing penicillins are resistant, you also see cephalosporin are also resistant because they have almost similar structure. All right. So one of the ways for this patient to still safe, which is the fifth question, is that they should always tell their doctors that they are allergic to penicillins. When the doctor sees that they are allergic to penicillins, the doctor is going to do what? Know what to give to them, what to prevent, what not to give to them, what to stop giving to them, what to withdraw. All right. So that is that for that. So now the last case study for this evening. The last case study for this evening. Um, Itchy eyes. Tunde Bello, age 16 years, plays football, very itchy, red, watery eyes for 1 week. Worse when playing outdoors. Has history of sneezing and running nose during dry season. What is wrong with his eyes? What medication can help? What should he not do? How can he prevent this? When should he see eye doctor? So what is wrong with the eyes? Those are symptoms of allergic conjunctivitis, which we all popularly refer to as Apollo in this part of the world. Symptoms: itchy eyes, red eyes, watery discharge. Usually both eyes are affected. All right. Sometimes you also have runny nose and the rest. Okay. So medicines that can help are ketotifen. Ketotifen is an anti-allergic medication. Okay, that is a corticosteroid. It contains corticosteroids. Okay, then you give the instruction for taking the medication. The eye drop is there. Now, basically, the rule of law for all eye drops are 2 drops. All right, 2 drops. It 2 drops accordingly. It can be 12 hourly, it can be 24 hourly. Depends on the drug. All right. Then antihistamine tablet will also work. As soon as you are giving steroids and or antihistamine topically through the eye, you're also responsible or required to give antihistamine orally. All right. Then you also describe how to use eye drops. I'm going to teach you drugs that are used for eyes, ears, nose, and and um, and tongue. Yes, I'm going to teach you drugs used for special senses. So I'm going to explain to you how eye drops are used. Okay, usually first of all you start by washing your hands, then you pull the head backward, you pull the lower lid of the lower eyelid, drop the medicine inside that space, and close the eye for 1 minute. You don't put the eye drop on the white surface of your eye because eventually that white surface is opaque and usually have some shield. So there's going to be a reduced level of absorption. Most of the blood supply in your eyes are actually in the lower eyelid. So you put it there and close the eye for some time. Closing the eye is going to ensure maximum impact of that eye drop inside the eye. All right. Then you don't blink rapidly. Okay. So what not to do? Question 3. Don't rub the eyes. Okay. It can cause more itching, can damage the eyes, can cause infection. Right. So how to prevent it? So you take antihistamine usually before you play football or do any sports because it was mentioned that this person is a footballer. All right, can wear sunglasses, dark shades. All right, so that it prevents other infections because pollens can usually be cause for what? For Apollo, what we refer to as allergic conjunctivitis. All right, so when to see the doctor, you see the doctor if after 1 week there is no result or there is no improvement or the pain increases or improves. You understand? That is when you have to see the doctor. So, class. Okay, I have some questions here. Sorry, I've not been following the questions. Okay, I've seen yes. Um, what if the allergy is mild? If the allergy is mild, class, it doesn't stop you from taking medication. You have to take medication whether the allergy is mild or not. All right. So, what about those that have itchy eyes caused by some food allergy? I don't know how food is going to. That's Sayande Jennifer. I don't know how food will cause itchy eyes. Food, eyes, no. I don't know how it relates. Okay. If that's the case, you stop the food. Except it's something that you cannot do without. All right. So whenever there's an issue with any allergic reaction from any substance, you stop it immediately. So closing eyes mostly lets the fluid leak out. How do you prevent this? No, if you do not apply it, or if you apply it on the opaque part of the eye, that's going to leak out. If you apply it in the pocket of the eyes, it won't leak out. If you just open your eye wide and you apply it on the surface. If I come to class tomorrow and for the ND2, if I come to class on Thursday, I should demonstrate that. All right, with one of your colleagues. So that is that for that. All right. So thank you very much, class. I really appreciate. I have been taking attendance. I think I have about 102 students. I have fewer ND2 class here. I have more of ND6, C squads. Sorry. So I've taken attendance already. I will advise you, if you know any of your friends that are not attending this class, tell them to attend. I will pay attention to these attendance more than the attendance to take in class, because classically this is where I'm going to set for tests, this is where I'm going to set for exam, because this is where I'm actually studying. We are actually studying what we are learning in class. There's no time to start taking any of this case study in class. So if you have any question, we should go through all of this case study we have handled, and then you ask the question. Ask the question in the comment section, or you ask it to me when you see me, or you ask it to the class rep, or you get my number. I can't remember my number here because this is a public video. You get my number from any of your colleagues who has, and send the question. And this way, you are sending a question. You not send it at night, send it during the day, and then drop all your courtesy. Don't wait for me to reply. You just say, "Good afternoon, sir. I have this question, blah blah blah," and that will do. I'll reply it as soon as I get it. So this drug allergy, can we say it's also adverse drug reactions? Yes, it can be. It can be referred to as adverse drug reaction. However, when it does not happen to many patients, it can also be referred to as an allergy, because some patients will react differently. Some patients will react differently. You understand? So hopefully this week we can clear everything about anti-allergy and address every other questions that we have. So thank you very much, everyone. There will be no form today, because I realized that the Google form I usually send, I get people that know attending class eventually filled it for the last time. So I just take attendance of those that are around, and I take attendance when the numbers are fewer. Because I know that at the beginning of the class, people will join. At the end, people will start coming. All right, so that's when I take my attendance when the numbers are fewer, so that I can really get those that have been staying in the class for all through the period. So I will advise you on Saturday next week, or Sunday rather, try to be around and ask questions if you miss anything. Thank you very much, and see you during the week. Bye for now.